Sean, wouldn't you agree that although we know you cannot date the gunshot wounds to the body, we don't know what's first, second, third, fourth, and so on, wouldn't you agree that the last ones had to be the ones in the head? Because that's what killed him.
Correct. If this is corroborated, I would agree that the last sequence of shots most likely will represent, in some sequence, the last two going into his head. And so the question is, why the pause and what was happening up to the pause and then after the pause? And that's why the officer's statement is so crucial in this case, which we have not seen or read any of that yet. Dr.
Michael Anderson also with us. Dr. Anderson, many people have talked about what shot was first, second, third, fourth, fifth, and sixth. Is there any way you can look at the body alone and determine the order, the sequence of the shots?
It is really difficult, if not impossible, to sequence the shot based only on the examination. And that's why, as you've said, there are a lot of different accounts of what happened during that tragic night. And that's why the folks that are in charge of this investigation, from the medical side, the medical examiner has a big task ahead of him. From the police side, a big task ahead of them. That is to take all of these different pieces of evidence, and I would call this audio tape, if corroborated, another piece of evidence, and try and piece it together into a story of what happened on that tragic night.
Joining me right now, special guest Daryl Parks, the attorney for Michael Brown's family. Daryl, thank you for being with us. What do you make of this coincidentally recorded audio, which I believe to be of the Michael Brown shooting? Of course, we're saying we can't independently